important bill. May you recall that this bill was read for the first time in this Hallowed Chamber on the 2nd of March 2021. Mr. President, distinguished colleagues, this bill seeks to establish the Federal Orthopedic Hospital Ubah, Anambra State. The establishment of this institution is informed by the importance of care for patient health. Orthopedics is the specialty of medicine that is concerned with the musculoskeletal system. This system is responsible for many important functions, including running, jumping, and swimming. Despite the importance of maintaining a strong musculoskeletal system, most people don't give it much consideration, which inevitably leads to health complications as people age. The Federal Orthopedic Hospital Ubah, when established, will offer comprehensive orthopedic care for joint replacements, fractures, joint pain, sports injuries, arthritis, and other injuries and conditions. In addition to minimally invasive and advanced surgery procedures, it is also offer a new approach to healthcare that focuses on compassionate, personalized attention for every patient and for the very best specialists and advanced treatment in orthopedic fields. This bill is a response to the cries of my constituents, especially those in densely populated areas who daily watch helplessly their wards suffer pain due to lack of well-equipped orthopedic hospitals. Mr. President, distinguished colleagues, many Nigerian communities suffer from severe pains of the bones and other related ailments due to the distance between the communities and tertiary healthcare institutions. Patients cannot access specialist hospitals where their ailments can be properly diagnosed and adequate treatment given. Densely populated urban and rural communities are worse hit. Their poor economic situation makes resort to patronizing private hospitals near impossible. Additionally, when established, Mr. President, the center will perform the following functions: to equip, maintain, and operate the hospital so as to provide facilities for diagnosis, preventive, curative, and rehabilitative services in medical treatment, to support and provide enabling environment for medical training of personnel as the board may consider necessary, to run an effective and cost-effective medical services to Nigerians, and to review and update medical findings and research from time to time. Mr. President, the bill, when passed, will provide services in specialized areas like diagnosis and treatment from traumatic events such as falls and car accidents, repetitive sports injuries. In line with Order 76.3 of our Standing Rules 2022 as amended, the financial compendium is hereby attached, Mr. President. I urge you all, my colleagues, to support this bill for the second reading. Thank you.
Looking at the need for this institution to contribute to our primary or healthcare delivery services generally. Mr. President, distinguished colleagues, the significance of this type of institution, the orthopedic hospital, is such that, of course, we don't have many of them. And by the time a citizen has any orthopedic issue, even the movement of the patient becomes an issue. And many patients have suffered because first, they can't even afford the kind of vehicle that may have to take them, given the fact that most people who have orthopedic challenges or health challenges will require special vehicular movement. And it means, for example, the families may have to even take a whole vehicle where they will have to pay expressly for it. So this is the challenge. And so when you have these institutions being brought closer to our citizens, I think that is the way we should go. And of course, because most of orthopedic, accidents occur through our roads. It means any Nigerian from any part of this country may find himself around the surrounding or the area where this hospital is, located, and could benefit if such an unfortunate incident happened. So, Mr. President, I see this as, a national asset that we should support. And of course, nobody knows tomorrow. And God forbid, if one finds himself in an accident, the next thing is you are talking about which hospital is closer. And I know most of these orthopedic hospitals are very far-flung. So, Mr. President, with this, I support that we, as a Senate, support the second reading of this bill, and to urge that we give it all the expeditious attention. I so second.
In the whole of Southeastern region, we have only one in Enugu. And the access, as we know, due to roads, just like my last colleague said, may cause patients to die before getting to the hospital. Mr. President, of course, people will say, what about resource limitations? But resources should not be a limitation to give good health to our people. This weekend, I was contacted while I was away in my constituency by somebody that had an accident along just Abuja-Mena Road. And it took almost 5 hours because the nearest hospital was Federal Medical Center, Bida, but that hospital does not have a proper trauma center. They had to come to the only trauma center close to the accident to be Abuja. Unfortunately, 2 of the patients died. The other ones were able to get to the hospital after about 3 hours of movement. The only support one could give was to call for ambulance from the Federal Medical Center to help those patients. I could imagine what will happen around this community where this bill is being proposed to establish the hospital. Similar thing will have happened. I therefore support that this Senate do give consideration to this bill, allow it to pass through second reading and subsequent passage, and hope that the President will assent to it for the community, not only in Ukpo, but around the Southeast generally, to have expansion of provision of orthopedic hospital to the citizens and residents of that area. I so second, Mr. President.
A bill for an act to establish the Federal Orthopedic Hospital, Ukpo, Anambra State, and for other related matters, 2022, second reading taken, and the bill is referred to the Committee on Health to report back within 2 weeks.